Thanks everybody for joining. And on behalf of Duke Margolis, I'd like to welcome all of you to this webinar on prioritizing equity. I think this is very timely. We've had a lot of really good news related to vaccinations in the US in recent weeks and months, with now a very large and growing number of Americans being fully vaccinated, over 125 million, more than 60% of adults have had at least one shot. And while we did see some significant differences in vaccination uptake across racial and ethnic groups earlier on, those have been diminishing in most states as best we can tell. In fact, the past week, a very large share of the total vaccinations that were given were to people in communities of color. So some important progress already, but we wanted to focus on today was how to build on that. Good news, we're still seeing lots of vaccinations, 1.8, 1.9 million per day, lots of growing real world evidence on why vaccination is important. Not only are we seeing effects in the real world that match those that we're seeing in the clinical trials, but growing evidence on just how important vaccination is in reducing transmission and thereby protecting all of the unvaccinated, and big declines in case rates and particularly hospitalizations coming with all of this increase, but still a ways to go, still some important disparities and a lot more knowledge or a lot more experience with how to address that. So that's what we want to focus on today. And before we get going on that, I'd like to turn to David Blumenthal for some opening comments. David, thanks for yours and the Commonwealth Fund's leadership on these issues related to health equity in this context around responding to and hopefully emerging with a better healthcare and public health system from the COVID-19 pandemic.
Well, thank you, Mark, and thank you to you and Hemi and your team and all the participants here for their hard work and leadership on the process of vaccinating the American people against this awful illness that has afflicted us for the last year. I know we're going to hear a lot of very specific information about the progress of vaccination and a lot of helpful suggestions about how to move forward in making that process more equitable over the next months and years. So I'm going to broaden the aperture a little bit and try to put in perspective the charge and the task that we're facing. This last year, of course, has been unique, not only in the brief history of the United States, but also in some ways in the several 100,000 years of our species on Earth. And for sure, humans have experienced devastating pandemic and epidemic illness before in 1918, before that with the plague, bubonic plague, and also with the European diseases that Europeans brought to America and that devastated indigenous populations here. But we've never had the means to control these afflictions. And now we do. And that's really what we're discussing right now. And we've also never had the means to collect information in almost real time to characterize the distribution of a life-saving service like vaccination. Information that can demonstrate inequities and create opportunities to improve them. And now we have that information. Never before have we had it with the kind of alacrity and completeness that we are coming to have it now. So in a sense, we have a chance to prove what humans, what our species can accomplish collectively, equitably, for our neighbors, for our brothers and sisters, and for our society. This unique history and a unique test in the history of the human race. It's a challenge for our time. It's unique, it's unprecedented, but also it's energizing and hopeful. And it's vital for our future to show that we can meet that challenge. It's vital for subsequent generations to provide an example for what we can do when we act together with firmness and resolution and commitment. In a way, we can be the generation that confronted epidemic and pandemic illness equitably and effectively the way a preceding generation, the so-called greatest generation, confronted fascism. So with that charge, I leave you all to the good work you're doing. Thank you again, Mark, for sharing this and for your work, and I'll listen with great interest to what follows.
David, thanks very much for those opening comments, and especially for putting the work that we're all engaged in now in such a, I was going to say historical, but as you put it, it's really more of a historic context in terms of the opportunities to make a difference now in this pandemic and prevent these kinds of scourges from happening again and from having the same kinds of inequitable impacts. So to get going, we're very pleased to be joined today as well by Bashara Shoker, who is the White House vaccine coordinator. Bashara is responsible for overseeing the national vaccination efforts for the Biden-Harris administration. He was named the Vaccinations coordinator to help with his focus on coordinating the timely, safe, equitable delivery of COVID-19 vaccinations for all of the U.S. populations in partnership with many federal departments. It's really an all of the above approach that the administration is undertaking, as well as in collaboration with state and local authorities, with businesses, healthcare organizations, and all of the private sector. Bashara also leads the administration's ambitious efforts to get to this, to build on the 200+ million vaccines that were given in the first 100 days to get to the goal of 70% of Americans with a vaccination by at least a first shot by July 1st. So Bashara, thanks so much for joining us today. I know from working with you, you've always got literally a million things going on.
Thank you so much, Mark, for having me. I'm really excited being here, being part of this effort, and being part of this conversation.
So where are we now in terms of your evolving set of priorities and opportunities for action on these big challenges that David laid out? So we've got in the US at least what looks like plenty of vaccine supply, at least no shortages anywhere, and supply generally exceeding demand. As I mentioned, if you look at the numbers, we're seeing more people from groups that had been subject of disparities at earlier phases, maybe in the vaccination effort, some of that evening out a bit. And I think I heard from Andy Slavitt that in this past week, maybe the majority of doses going to minority populations. And as I said, the infection rates are down. We're seeing people getting back towards more normal lives. What's top of mind for you? Because it seems like we're not there yet, at least not there for all of America.
Well, first of all, I just want to start by thanking everybody on this call, because to get to this point was literally an all hands on deck approach. And I'm in awe as to how this country came together from a government perspective at all different levels, the private sector, the not-for-profit sector. And we've made great progress. I mean, just every time I say this out loud, I'm so excited that we've administered as a country almost 280 million shots. Like, that's just, I have to say it twice to realize how important that is. We have, we have about 160 million people with at least one shot, and about 126 million people in this country fully vaccinated. Great progress. We've got the 100 million, we've got the 200 million, and now we have this new target that's going to be really hard to achieve, but I have no doubt that we'll be able to march and sprint toward the 70% of adults with at least one dose by July 4th. Two things to keep in mind. I think in the initial phase of this campaign, obviously there were a lot of people who were excited about the vaccine, raising their hands, scheduling appointments, chasing appointments, standing in line at the end of the day at community vaccination centers. Those days are pretty much over. And now where we are in the second phase is truly about three key areas that we're focusing on. The first part is to continue to make access easier and more convenient. So access can have to continue to be part of that equation. The second piece is about continuing to build vaccine confidence. And the third area in our focus, which has been from day one, is to continue to keep equity at the center of our work. So to think about it, if I think about it, Mark, here, there's still people who want to get vaccinated, truly want to get vaccinated. We have to continue to make it easier for them and more convenient. That's why you're seeing us making a lot of walk-in appointments, no appointment needed to come in and get vaccinated. The majority of our retail pharmacy locations now, you can just walk in. We're encouraging states. I know a lot of states and locals are doing the same. Uber and Lyft are offering free rides between May 24th and July 4th for people to get to and from vaccination centers. So there's a lot of these great strategies that we're seeing, a lot of innovation across the country to continue to make it easier and more convenient for people to get vaccinated. The second big part is truly about continuing to build on vaccine confidence. And we know there's still a lot of people who have questions, and all of these are legitimate questions. And we have to make sure that we're giving people facts, we're giving people answers so that they can make their informed decision. And we're hoping that once they get all this information, they'll raise their hand and they get vaccinated. And as always, equity is going to have to be needs to continue to be at the center of this work to get us closer and closer to the 70%. And Mark, I mean, I'm confident that as we get closer and closer to the 70%, we're going to see further declines, steeper declines in number of new cases, number of hospitalizations, number of deaths, similar to what we've been seeing over the last few weeks.
So great overview. Maybe to build on, Bashar, some of the pieces that you described there. So lots of steps for easier access. Vaccines are in pharmacies all across the country. So 90+%, 95% of people are within a few miles of a vaccine. Thanks to all of these community sites, free rides, transportation. What are the next promising frontiers, though, for improving access further? We've got a number of employers that we've been working with, for example, that are interested in taking further steps, maybe collaborating with local public health authorities or healthcare providers or pharmacies in the area to bring the vaccines even closer to their workers who may be having trouble finding time or getting support to get vaccinated. I've heard from many schools, especially with adolescents now being vaccinated as well. Can they be part of this? Where do you see some more opportunities for improving ease of access?
Well, Mark, this is a fantastic list of opportunities that we could still continue to finesse and improve and optimize. And I've been spending a lot of time with public health leaders at a state level and a local level, and a lot of great innovative ideas that we're seeing across the country. A couple of examples that I'd highlight here that I thought were very intriguing, very interesting. I think employers are going to have a big role to play. And I think on the employer side, I think of three different buckets of strategies there. There's obviously the paid time off, because we don't want people to lose money from their paycheck just because they want to go and get vaccinated. So I know the presidents had called on businesses to make sure that people get paid time off to get vaccinated. And should they need a day or two to recover from feeling under the weather, we'd want to make sure that that's covered. From a policy perspective, as you know, medium and small size businesses can apply for tax credits for the paid time off they provide to their employees. So I think the paid time off continues to be critical for employers to offer to their employees. The second piece is around incentives, and we're already starting to see innovative ideas that employers are doing to offer incentives for their employees. And the third part is on-site vaccination clinics. And I know there are multiple models out there. There's still some, wrinkles that we're trying to help navigate and help straighten, but there's still lots of opportunities there. I think schools is another frontier. And as we get into the adolescent vaccinations, we've got a great start to the adolescent vaccination for the last week or so. I think schools could play an important role, not just for adolescents, but also for their parents. I think pop-up clinics, it's just going to need to continue to be really important that we make access closer to communities. And, I know 90% of people in this country are within 5 miles of a vaccination site, but 5 miles is 5 miles. And for a lot of people, 5 miles is a barrier. So we've been seeing more and more pop-up clinics, mobile clinics. I got a chance to spend some time with the Denver health team in Denver on Friday, and got to go with them and visit with one of their mobile pop-up site that they're doing at a church in Denver. Again, lots of people who want to get the vaccine genuinely, and you eliminate the barrier, you get an opportunity to be able to get vaccinated. I'm seeing a lot of innovation on people who are homebound, and how do you schedule somebody to come into your home and give you the vaccine? Chicago has a great model there. So we're seeing Louisiana, New Orleans, Louisiana has another model there. So lots of great innovative ways, and the more we can share those best practices, and I know you all have done a fantastic job in sharing those best practices, putting white papers out, all of that help.
Yeah, and just to say, one of the other groups that we work with or collaborate with is the COVID Collaborative. We're part of that big public-private We Can Do This campaign. For those who are interested in some more tools and resources along these lines, there's an event coming up tomorrow. Bashar, I'd expect you. I know you and the administration are involved in too. So just Google We Can Do This and get access to some more of those kinds of resources. Okay, so those are some important steps and opportunities ahead for people who think they want to get vaccinated but haven't been able to find the time or space to do it. What about that remaining portion that still have doubts? May not be completely hard over, but still have some significant doubts. And this would include if we've seen some of these gaps close, as you mentioned, for racial and ethnic minority populations, but still some issues there. Also for rural individuals, more conservative people who have more conservative leanings. Any new developments or highlights you'd like to point to in engaging, as you said, those communities that are still behind a bit in terms of vaccination confidence?
Well, let me just start by saying, there's still a lot of people who have questions, and all those questions are legitimate questions. I'll tell the story of both of my parents, my mom and dad. They had questions. They weren't ready to kind of raise their hand and go get vaccinated from day one. I sat down with them. I answered all their questions. They got more and more comfortable. My dad was the first one to get vaccinated. He's now fully vaccinated. And my mom got her first shot a couple of weeks ago. So she's waiting for her next shot. So I feel like people have questions, and that's why the community core effort that we've launched, that now have thousands and thousands of people and organizations across the country, is so critical, because people trust people they know. And when you arm people you trust with answers, facts, frequently asked questions, social media posts, templates, and other stuff, that would make a difference. So it's really important that we continue to build on this effort. The other big part here is absolutely critical in this phase of the campaign is the role of physicians and primary care docs and physician offices. We know from surveys and focus groups, particularly for this group that still has questions, the doctors, their primary care doctor, is the most trusted messenger when it comes to COVID-19. And that's why we've been focusing extensively over the last few weeks on making sure that we're getting more and more primary care docs to be vaccinators in their own offices. If they haven't signed up yet, we're supporting them getting signed up, and we're making sure that we're putting more and more of the local docs out in the media telling the importance of getting vaccinated. All those are important strategies to help us close the gap, help us get to the 70%. A lot of work on the rural side. Happy to chat about that if you want me to. Like you said, we're starting to see closing of gaps and disparities. I think in the last 4 weeks, 22% of shots in this country have gone to Latinos, and they make up 17% of the population. That's the type of effort that's going to be needed, and the type of outcomes that we need to get to be able to help us put the pandemic behind us and do that in an equitable way.
So you mentioned that people do trust their physicians, their primary care provider, and the more opportunities people get to talk with those with their trusted provider about vaccination issues and the questions or concerns that they have, the better. Are there things that employers should be thinking about to help people connect maybe to their health professionals or to other resources in the community? Things that we could put up on our list of employer best practices for all of the employers out there that are working with this effort?
So we're seeing a lot of innovation on the employer side, and we're really encouraged to see that, and we'd like to see even more of that. I think a lot of employers are already engaged on the education front, whether leveraging their already existing venues to engage with their employees, provide the education, provide the facts to their employees. We're seeing employers engage in figuring out different incentives for their employees to get vaccinated, and it ranges across the country. And we're seeing employers are interested in setting up on-site vaccination clinics. One of the models I think I've learned about a few weeks ago in Wisconsin, for example, the state health department is playing a matchmaker between employers who want to have on-site vaccination clinics and providers, health providers who can make that happen. So those types of activities are going to be really, really critical. And we encourage employees to think about efforts on all these three fronts: the education front, the incentive front, and the on-site vaccination front, if it makes sense for employers.
And we are going to come a little bit later on in this webinar in our discussion about some of the employer promising practices out there to talk more on those kinds of topics, as well as the opportunities for collaboration with states. But you did note, Bashar, that we're still seeing some disparities in rural areas. I know we've only got about a minute left, but any quick comments on promising directions? I know lots of states are concerned about those disparities too.
Well, I mean, I completely agree with you. And I think we have to think about, again, the access and the confidence. And I think from an access perspective, at the federal level, we've just started a new program that's engaging directly rural health clinics. There's about 4,600 of those across the country. And now those clinics have the opportunity to sign up and receive vaccines directly through HRSA, which we're really excited about that. We started this program a couple of weeks ago, and we have many sites that are already receiving vaccines, would like more of that, more of them to sign up. And the second piece is around vaccine confidence. And again, people in rural communities, just like people in urban communities, have questions, and we want to be able to answer those questions. And as part of the American Rescue Plan, these 4,600 rural health clinics are eligible to get $100 million worth of resources to support building vaccine confidence in their communities. And we'd want to make sure that as many of those clinics as possible are raising their hands, getting these funds, and working on vaccine confidence in rural America.
Bashar, I want to thank you for taking some time to be with us today. You covered a lot of ground, many reasons for optimism and hope about the progress that we've seen in vaccinations in the United States. Still a ways to go here, a ways to go around the world, and I know you're going to keep at it. Really appreciate your joining us today.
Thank you, Mark, for everything you do.
Take care. And now we'd like to go right into discussing some of those promising practices to reduce racial and ethnic disparities in vaccination rates that are being undertaken by states. And for that, I'd like to turn this to Hammy Tourson, who is going to be leading the next segment of our webinar.
Thank you, Mark, and for that great discussion. So in this next segment, we're really going to talk about, how have states approached addressing disparities? And, as we all know, the COVID-19 pandemic has highlighted disparities with a disproportionate impact on Black, Latinx, and Native American populations. During the initial rollout of vaccines, there really was an emphasis on speed. So states and localities really having to do things as quickly as possible. And I have to say, I really appreciated hearing Bashar's 280 million shots, incredible work done at the state level, and kudos to state leaders who really have been working 24/7 to really try to get the shots into the arms of millions. And we've only been at it since the end of December, and really incredible progress has been made. But with the emphasis on speed, states also realized they had to focus on equity, because when you're sometimes going for speed and efficiency, equity can be left behind. So today we wanted to talk a little bit about what are some of the specific steps that states took and are taking to ensure that they're addressing communities of color as well as other populations who may not be coming forward to get vaccinated. We're right now at a place where supply is outpacing demand. And so, what states implemented as strategies sort of earlier on in the pandemic is shifting. And there really is now a focus on how do we micro-target populations and really make sure the outreach that states are doing are effectively getting to those who would like to get vaccinated and those who may need to build more confidence. And I'm really excited now. I'm going to introduce the panel, and if you all can come on screen, we're really so fortunate to have this excellent panel with those who have deep experience in addressing all of these challenges, both at the state and local level. And over the next, close to 30 minutes, we're going to have a discussion about their perspectives on how things have progressed with communities of color, as well as other populations in the vaccine distribution efforts. So first, I'm going to introduce Laura Parjon, who is the Deputy Secretary for the New Mexico Department of Health and the Executive Director for the Office for Community Health at the University of New Mexico. And New Mexico, a state that has some challenges with rural and frontier areas, and lots of folks who are on Medicaid and who are at lower income, has a state that's really done well in getting the vaccine out to these populations. And so really interested in hearing her perspective. We also have Dr. Charlene Wong, who's the Chief Health Policy Officer for COVID-19 at the North Carolina Department of Health and Human Services, as well as an Associate Professor of Pediatrics at Duke University. And North Carolina is a state that has really done some fantastic work on addressing communities of color. And really, we have here at Duke Margolis highlighted the steps that they've taken in their work in addressing that population. So interested to hear her perspectives today. And then we have Dr. Carlos Del Rio, who's a distinguished professor of medicine at Emory University, who is not only very knowledgeable about what's happening in Georgia, but also at the national level, and really has some incredible experience understanding communities and how the vaccine distribution effort has rolled out in these different segments of the population. So I'm really looking forward to hearing from all of them during the next 30 minutes. And we're going to try something different for these 30 minutes. We're going to really have question and quick answer, quick, in quotes, really so we can get the different perspectives of all three panelists and try to get to as many questions as we can, because there's a lot of areas that we want to cover. So I was going to start by posing a question to all of you about, what has been your lessons learned to date on addressing equity in the vaccine distribution process, the success and the challenges. And I might start, just because this is the person next to me on the Zoom, is with Charlene, if you want to kick us off on that.
Amy, well, first of all, thanks so much for having us and hosting this panel. I think one of the key lessons we've learned is that it's just been so important to take a multi-pronged approach to addressing equity in the way we've worked to distribute vaccines as equitably as possible. And for us in North Carolina, we have been working in a three-pronged approach. The first is to earn trust, as Bashar was just talking about, and just really the importance of partnering with trusted messengers in the community. The second being the way we've embedded equity into every aspect of our vaccine distribution operations. And the third, which I think we'll talk more about, is sharing accountability through data transparency and using data to drive decisions.
Great. Thank you, Laura. Do you want to go ahead and respond to that question?
Oh, great. Thanks so much. Yeah, thanks again for having all of us here. And yeah, New Mexico does have special challenges. It's very rural. It has the highest SVI out of all the states. And so one of the challenges we was how do we get out to those rural communities? So from the very beginning, we had a distribution allocation system that we addressed trying to get to high SVI locations. The other thing was having a centralized registration system so that we could look at zip codes, we could look at race, ethnicity, and actually use that system to push certain groups, in front of others, in the sense of the older seniors, people who were African American, people who were who were Native American or Hispanic Latino, because they had been disproportionately affected by COVID, and then using data to drive our action. So those were kind of like our three key things. And then keep on working with the communities to share that data with them, to encourage them to work with us to figure out ways to reach the people that really weren't getting to the vaccine sites. And challenges, I think we did want to get a lot of vaccine out, and it is easy to get sucked into let's get the vaccine out quickly, and then the equity piece falls behind. And that's what actually happened right now with the 12 to 17-year-olds. When we opened up to 12 to 17, then we got a lot of people, the people who had more access were able to get their 12 to 17-year-olds in first. So just still keep on working on that.
Yeah, absolutely. Thank you. Carlos, why don't you go ahead?
Well, a lot, Charlene and Laura have said a lot of really important things, and I just want to, summarize without being too repetitive, but trust and transparency is critical. And I think measurement is critical. If you don't measure, you don't know what you're doing. And I think keeping track of exactly what's happening, I think is very important. Some places, for example, in DC and other places have looked at, okay, if I put, a vaccination site in this borough or in this zip code, I want to make sure that people from the zip code are the ones that get the vaccine and not that come from another zip code to get the vaccine. The second thing is about making equity a priority. If you don't make it a priority, it doesn't happen. You have to talk about it. I think you have to listen more than you talk. You have to hear what the community has to say, because sometimes we think we have the solutions and we don't. So listen to the community, get them to participate, tell you what they need. And you have to make yourself available. When they say we want to have a webinar at 7 p.m., you have to make yourself available so you can actually answer questions that people have at that time, in that moment. But I think at the end of the day, we have to all recognize that equity is hard. If it was easy, it would already happen. And that equity, therefore, is a labor of love. And you really have to get your gains slowly and build on them. And you have to realize that some things you tried just didn't work, and then try something different and keep on trying. And eventually you'll find, what the right answer is.
Yeah, thank you. Great. Now I wanted to dive a little bit deeper into, some of the areas that you all touched on in your remarks, and I might turn back to Charlene first. So, North Carolina, I think, has done a really interesting job with trying to incentivize thinking about equity in a new way in this vaccine distribution effort. And if you could just comment a little bit on kind of what you've done on that front, and then, how the ground may be shifting and where you may be looking next in the state as you try to do outreach.
Yeah, I'll comment on sort of that second piece I mentioned, which is how we embedded equity in our vaccine operations, because I think this was really powerful. When we were in the place where demand was far outstripping our supply, we were very intentional about the way we were doing vaccine allocations in a way that really addressed equity. So we were looking at, for example, regions and areas in the state that had higher proportions of historically marginalized populations, our Black, our Latinx, our American Indian populations, and then providing additional allocations based on those data to those areas, making sure we were reaching out to providers in those areas to ensure greater access, easier access. As we have now transitioned to the point where we do have a supply that is outstripping demand, our focus has really been very much in line with what Bashar just said, making vaccine easy, making it everywhere. And to that end, we have really been engaging with our primary care providers as those very trusted sources. We also have a very exciting initiative launching in North Carolina called Healthier Together, which is a regional infrastructure to engage and support community-based organizations and local partnerships, working both on the supply side as well as the demand side, with a very intentional focus on equity and reaching historically marginalized populations. Those are just some of the examples that can go on more as there's time.
Great, thank you, Charlene. Laura, I wanted to talk a little bit about just to build off of some of the comments that you mentioned about your frontier and rural areas. So, I have been to New Mexico many times, and it's certainly a challenge. It's a wonderful state. It's certainly a challenge to reach those populations and do it in an equitable manner. I thought you might share with the group here, what has been sort of quote unquote successes in reaching those populations, and where do you feel like you still have some work to do?
Yeah, I think from the very beginning when we started, we wanted to make sure that, we weren't tempted by just having all the vaccine in the cities where it's easy to reach. So when we initially started, we actually had a whole vaccine distribution warehouse that used National Guard to get out to all the providers. And we made sure that we had we prioritized providers in rural communities as well. So that's one way we did that. We also, as we started seeing that, rural providers initially did a really good job of getting out the initial group that really wanted the vaccine. But as we saw that slow down, we then put National Guard, we kind of closed down our warehouse, because then we were able to get federal doses like Moderna into those community clinics. And they were then saying they didn't have enough capacity to vaccinate all the people. So then we started doing National Guard mobile teams that would go out to rural and frontier areas. We're seeing a slowdown in some of our frontier areas. It's interesting, certain areas did really, really great. And then certain areas, because of that vaccine, lack of confidence, concerns, certain areas of the state, like the Southeast, very, very low uptake. So we're trying to work with them as well as our DOH team. Our Department of Health team has been amazing in getting out to those areas, but we're now trying to see how we can actually work with the rural areas to be going to areas like post offices and different locations that there definitely is some place where we can be. But this is literally long haul work for us. It's like, community by community and just getting out there. So we really have increased our mobile capacity in the last few weeks, and we're really going to ramp up in the next few weeks as well to really get to rural communities.
Yeah, no, thank you for sharing that and for that important work. Carlos, I'm going to turn to you now. We talked a little bit about, Black, Latinx, Native American populations. There are other populations that have the need of building more confidence and really coming forward and asking for the vaccine or being willing to get the vaccine. With this micro-targeting effort, how do you think states, localities, and communities can be most effective in their next steps as we look forward with this effort?
Well, a lot of people don't trust the government, right? They're not going to go to a state or a local health department or a federal government clinic, but there is trust, as Bashara said, in business. So I think critically important are partnerships with business, and there's also trust in their local physicians. So again, involving the local clinicians, their doctor is going to be important. I'll tell you three stories of things we've done here or partnering with business. The first one was, with Tyler Perry Studios, in which, we initially worked with him and to get, to try to get vaccinations there, and they were not interested. And eventually, as he talked to people and people got convinced, then what he did is he just set up, 2 Saturdays in which his employees and the family of his employees could come and get vaccinated. And it was incredibly successful that he actually made it easy. He provided breakfast, and our job from the state and from the healthcare system was to bring the vaccines, to bring the staff. We set up a clinic, in the parking lot, and we got people vaccinated. The second one was, when Georgia announced that, for example, Braves games were going to full capacity, I immediately said, oh my God, this is going to be a mess. And I try to make, lemonade out of lemons. So rapidly called the Braves and I said, how about if we set up a vaccination partnership? And you give us a space, we'll set up a vaccination clinic. And if people get vaccinated, what can you do? And they said, we'll give people to get vaccinated 2 free tickets to future games. And sure enough, we started doing that, and people that were coming to the game, all of a sudden were getting vaccinated. 300-400 people every day that were coming to a game were getting vaccinated. And then, with Delta Airlines, Delta set up a clinic inside the Delta Museum for their employees. But then we use the same space, the annex space, to set up a clinic run by FEMA, by the government, but it was attached to Delta. So they saw it as a part of the Delta collaboration. And this was a drive-through vaccination site, but it's very clearly that many of the people that wanted to come there did not have a car. So then what we did is we just partnered with the local transportation and with Uber and with MARTA to get people rides into the vaccination clinic for free so they can actually get vaccinated. And that increased. So I think you just have to be creative and you have to see what's needed in your community. How can you get a trusted partner involved? And I say trusted partners, Delta's trusted in this community, the Braves are trusted, Tyler Perry's trusted, and how you get them to be champions and help you in the vaccination. And then you reach those communities of need.
Absolutely. And creative thinking is going to be rewarded in this space as we think about different types of incentives. I wanted to go back, Laura, just to follow up on a comment that you made about adolescents. So it's interesting that you're seeing as the vaccine rollout for the 12 to 15-year-olds just happened last week. And I have a 13-year-old. She was running, to get the vaccine because all her friends were texting her about it. I mean, there's certainly certain people that are coming forward to do that. Curious in terms of, for those groups that aren't coming forward and kind of being the first in line, how are you thinking about reaching those populations? And are there partnerships with schools or other entities where you're going to try to make sure that you get all of those kids vaccinated in a timely way?
Yeah, I mean, I think it's that balance between like who wants it right now and like they'll come and get it. And so they'll, and that's disproportionately people who have access. And then we also need to keep on working on those other sites. So for instance, one of the things we did was we partnered with United, which is our soccer team, which is an awesome soccer team here, and people are super excited about soccer. So we partnered with them to do an event. So we got a lot of people who were Spanish speaking and had come to the event with their kids, and they got vaccinated there. We're partnering with schools, with community-based organizations, and letting them know that it's okay to, like a lot of them just didn't know that they're like, what? Your 12-year-olds didn't, your 12 and overs can get vaccinated. We also did when we did the United game on Telemundo, which is a Spanish-speaking, Spanish-speaking group. I speak Spanish, so I was able to go on Telemundo and tell them in Spanish, like, hey, you can get vaccinated for your 12 and ups, and they were like, what? You can? And so we got an influx of people just coming and registering for their kids, just like speaking to people in their own language and getting information out there is what we've been trying to do to make sure we can get those populations. But it's hard going, like Carlos and Charlene said, it's community by community and thinking of different ways to reach out. We're thinking of doing some food trucks and, doing a lottery as well. Our governor's organizing to do a lottery. So I think that's going to help drive some vaccine, in terms of people who we're trying to reach. So.
Amy, can I just add on to that?
Yeah, go ahead.
I think, another thing that we're hearing, and I'm a practicing primary care pediatrician, so it's been awesome to see the pediatricians really make such an impact in this space. And actually, we're hearing from so many of our pediatricians, they are vaccinating whole families. We actually have one pediatrician, for example, in our state, they think over half of their vaccines actually have gone to adults, even though they were intentionally sort of reaching out to vaccinate teens. And we are hearing, particularly in our Black and Latinx communities, that there is this real desire to get vaccinated as a family unit. So I think it's nice that that is now also an opportunity. And then I think, Laura, I think it is really bringing the vaccines to places where kids and families are going, places they trust. I'm volunteering this weekend at an event that's at an indoor roller skating rink, where they're really, we're really focused on trying to reach out to particularly Latinx families with teens. So I think that'll be really fun.
Yeah.
So, two things that I would like to propose, because I think there are opportunities that we're still not totally taking. And one of them is I really think we need to integrate testing and vaccination, because anybody who comes to get tested has been exposed, and many of them are not vaccinated. So in places, I have been working with a business here that is doing testing, and we got them to integrate vaccinations, and it has been incredible uptake. They're doing 600-700 vaccinations a day by offering vaccination to people that come to get tested. And the second thing is, I really think we need to start looking at every new diagnosis of COVID, as I was telling somebody, a vaccination failure, not a vaccine, but a vaccination. And therefore, that person newly diagnosed needs to be said, this person has not been vaccinated. How do we rapidly get our contact tracers and others out to find their family members or close contacts and vaccinate them, because chances are that that person's family also is not vaccinated. And I really think by doing that, a little bit of the ring approach that was used for smallpox, we can probably cover a lot of people that are not being reached by vaccines. So in other words, don't wait for them to come to us. We need to go to them, and having a new case should be an index that we need to be out there.
Yeah, no, thank you, Carlos. And I think that's absolutely right. Is integrating these different pieces when you know that somebody thinks they have COVID or may have COVID, and pairing that with vaccines, I think is absolutely important. And then with the contact tracing as well to reach those around them. That actually brings me to the next point. I want to talk a little bit about data. So, we know that, great progress has been made. And, Bashar talked about how, 22% of shots are going to Latinos, and they represent 17% of the population. I'm curious at the state level, how does the data look? Do you feel like you're really sort of making progress with communities of color? And how are you really determining where they're going to continue to still be gaps and use that data to effectively figure out what the next step is? I don't know who wants to go first on that.
Yeah, Hammy, I'm happy to jump in. So I think, as a starting point, we felt it was so important, of course, to actually have as complete data as possible to inform our efforts and to have that shared accountability. And so early on, and as we started into the vaccination efforts, we made sure that it was required that vaccine providers indicate race, ethnicity. And so we have a very, very complete data on race, ethnicity, upwards of 95% in North Carolina. So I think that was step one for us. Step two is, in order to have shared accountability, there needed to be that data transparency. So very early on, again, in our vaccination efforts on our public dashboard, we made it possible for folks to be able to toggle different race, ethnicity, different age groups. So folks could see where we started, where we were going. So we could see where we had improvement and where we still had work to do. We also sent individual reports back to each vaccine provider with their own distribution of how they distributed their vaccines, and compared that to where their demographics are in their local county. And then finally, we're very excited. Most recently, we have published a map that overlays both vaccination rates as well as the social vulnerability index by census tract all the way across North Carolina, so that our vaccine providers, as well as our partners like our community-based organizations, our faith-based organizations, can really hone their efforts in on where we see both high social vulnerability as well as low vaccination coverage. And we have overlaid onto that map where our vaccine providers are. And we collected a list of community-based organizations that raised their hand and said, we are ready to help with vaccination efforts. We'll send volunteers, we'll offer our space. And those are also shown on that map. So people can really zoom in and where they are in North Carolina and see where they can focus their efforts to really get the most equity and most sort of juice for the squeeze of all this very hard work that we've all been talking about. And we're already seeing success with the use of that map. For example, areas we focused in the department on those areas where we had no vaccine providers in census tracts. And we really worked with our associations and our healthcare providers to say, you are in an area where there is really no one available to give vaccines. How is it we can support you in becoming a COVID-19 vaccine provider? And we're seeing uptake there as we make it, again, easy and everywhere for folks to get vaccine.
Well, that sounds like a magic map. And hopefully will be useful in your efforts. I want to hear from Laura too, but before I go to Laura, I also am curious, to Carlos's point about figuring out the testing and the contact tracing along with the vaccines. Is that something you've thought about in North Carolina with all sort of the data that you've been doing with and analyses?
Yeah, and we've had a lot of data system connections that have happened because of COVID-19 and are really thinking through that. And actually a lot of what we did in our vaccination effort, we were learning from what we did in testing. And Carlos, many of our, for example, vaccine vendors are also testing vendors because they had made many of those community connections and identified places where they were reaching some of those historically marginalized populations most effectively. So they had already learned that in testing and were able to apply it very quickly in vaccine distribution.
Great, thank you. Laura.
I'm so jealous of your map. I want that.
Everyone wants the map. Okay.
I know, I'll be reaching out to you about how to do that map. We do this similar thing of, identifying locations as SVI, race, ethnicity. But I think one of the coolest things we've been doing is with the community health workers. and working with our community health workers to use the CDC rapid community assessment. And so I'll just like share a little bit of story of how that happened. So our community health workers working with our community-based organizations worked with us to identify, community organizations that were having trouble getting people vaccinated, and then identified a series of key messages that we were able to use. And then, so for instance, in the Mexican consulate, people were concerned about needing an ID. They were concerned that it wasn't free. They thought that because there was an insurance question that you needed to have insurance. We changed things so that we made flyers that says you don't need an ID, you don't need Social Security, you can walk in, it's free. And doing that really increased our numbers for the population. So really like having the CHWs doing the rapid community assessment, helping to get that analyzed together with our team, sharing that back to the community to develop flyers, and then having the site, having a town hall and then having the site there at the location where we did it really helped us to get higher uptake. And so just kind of, I don't know, it just requires so many pieces, I think, getting to this last mile. And Carlos said, a lot of love, just like, yeah, we're here for you. We recently set up a site where the community-based organizations, churches, anybody can ask for a site. And then we bring the mobile team there. So it's kind of some of the stuff of how it all works in our system.
Yeah, no, that's great to hear. And, I think your comments about, allowing walk-ins and like removing the documentation requirements, again, it's like to Bashar's earlier comments, like making it as easy as possible and as safe as possible for some of these populations. It is really key. I will just note, we were talking to Alaska the other day, and, they were talking about their tribal populations, Native Alaskans. And, they were like, we had to vaccinate the entire community even early on because the elders wouldn't come in without, their families, and they had to feel trusted. And so, I think to your point about, this is the extra work. This is why it's going to be the harder mile, right? Of really, going like population by population, community by community, figuring out what's going to resonate and what are all the different steps that you all have been talking about that are going to be most impactful. So thank you for sharing that. I have a question probably, for any of you on the panelists in the last 2 minutes that we have here. Earlier, we talked about primary care providers and pediatricians and how that plays a role. Do you think that that's going to be just as impactful for communities of color? I do sometimes have concerns that some of these populations may not have a regular primary care doctor that they're going to. And do you think that, PCPs are going to be the way to reach them with education? Or, are there other ways we're going to need to think about this group as we look forward? And so, I don't know, Carlos, if you want to start with that.
Well, I think it's all of the above. I mean, again, you're not going to find one strategy that works for everybody, and I want to emphasize that it really is the sort of the easy group to vaccinate. It's already been vaccinated. For the hard group to vaccinate, you're going to have to try very different strategies that will give you little incremental gains, but there's not one magic bullet that is going to work for everybody. And I think that's something that we need to get into our heads, that this is not, here's what the solution to our problems. Every single little thing you try may be a little different, may work for some, may not work for others. I do think that, for example, again, we talk a lot about communities of color, but the reality is, at least in my state, the biggest group of the population not vaccinated are rural whites, Republican, hardcore Trump supported rural whites. So there's a county, for example, in Georgia, Bacon County, 100% white population, 110,000 people live there. Less than 200 doses of vaccine have been given there. So talk about disparities. That's the group we need to get to. And how are you going to do that? Well, they trust their local doctors. They don't trust the government. So you have to work with their local doctors to do it. In a Hispanic community, as Laura was saying, we work with the Mexican consulate because people go to the Mexican consulate to get their papers and their other things, and they like to go there. Yeah. But I do, I want to end before I end. I want to say that, just like Charlene showed, data is important. Showing data and having data is available. With my team here at Emory, we've developed a COVID health equity dashboard, and the health equity dashboard, we have a vaccination health equity dashboard. So we can actually track vaccines, and we can get down to the state level, and you can then go to the state and find out exactly what's happening at the state level. And down here you can see the race ethnicity composition of who's getting what percentage of the population, who's getting vaccinated, et cetera. And then with colleagues of at Georgia Tech, at Georgia Institute of Technology, we've done a similar thing. And the Georgia Institute of Technology has developed something that they just put out, which is a COVID-19 vaccination tracker, in which, again, they're tracking vaccination by county in the state and having very granular data of where you're going, and using our academic colleagues in other areas like Georgia Tech to come up with this data and show it in visual ways that we can then get to the local authorities and say, in your county, this is what you're getting to. It really makes a big difference.
Great, thank you. Charlene and Laura, any last words on this topic? And then we're going to move to the next panel.
I do think, like Carlos said, it'll be multiple strategy, though I do think primary care docs are going to be really important for particularly that group Bashara identified who still have some of those questions, and making sure that people have access to a vaccine at their primary care doc who can answer those questions and then immediately offer the vaccine.
And
Laura, you get the last word.
Oh, wow, that's awesome. Well, we have a lot of, I think primary care is important, but also a lot of our population doesn't necessarily have a primary care doc. So really using the Department of Health as a place of last resort, like a lot of people use this as a safety net, and also just getting out to events and places where people are going. I think that's kind of going to be our strategy, one of our strategies going forward as well, to get the group that doesn't have a primary care doc.
Okay. Well, thank you, all three of you, for the excellent discussion, and thank you for your work on this. It clearly is having an impact, and will continue to have an impact in this pandemic. Charlene did add the link to the North Carolina Magic Map in the chat, and Carlos has added a lot of resources as well. So please feel free to access those. I'll turn it back to you, Mark. Thanks.
Great. Thank you all, Hammy, Carlos, Laura, and Charlene, for combining clearly a lot of energy with good data and analysis for effective state strategies. Just as long as we're adding things to the chat, it's a reminder that Duke Margolis released yesterday, thanks to work by Andrea Toomey, Hammy, and others, a report on some of the promising practices, like some of those you heard about today, that states have been using early in the vaccination process that have made a difference. So some more information there as well. Right now, I'd like to turn to, in this session, to focusing on partnerships and initiatives involving the private sector, America's companies and employers, to engage communities and enhance vaccine equity. And for this session, very pleased to be joined by Lisa Smith, who's Senior Director for Clinical Excellence at Walmart, my former colleague in government, Liz Doherty, who's General Counsel, the Business Roundtable, and Dan Laster, the Director of the Washington COVID-19 Vaccine Action Command and Coordination Center, or VAX, at the Washington State Department of Health. Thanks all of you for joining. And we've asked you here because of the perspectives that you all can provide from the efforts that you're undertaking on how the private sector can play an important role in promoting equity and COVID-19 access, vaccine access and uptake. We've heard some great examples already from Bashara, Carlos, the last panel, on-site vaccination clinics and rides, other steps to make it easy, paid time off, Braves tickets. We know that as well, as we've heard earlier, employers have a relatively high level of trust relative in the United States, so important partners as well. So I'd like to hear from you about some of the successes, lessons learned so far, and maybe opportunities to do more. We are entering this phase we've just been talking about, where problem isn't so much vaccines being available at many places, but it's getting the vaccines right to where people are and engaging them in questions and concerns that they have. And boy, it seems like we're shifting into a phase where employers, companies are just going to be more important. So Liz, if you don't mind, I'll start with you, as I know the BRT's been doing a lot on pandemic response. I want to thank you all for your efforts globally in response to the challenges that India and other countries that don't yet have the kind of vaccine access that we do are facing. But I know you've also spent a lot of time time at the BRT on effective methods for promoting access and uptake of COVID vaccines, both for employees and for the public that deals with your company. So maybe you could start us off with some thoughts on the topic.
Great. Thanks so much, Mark. And thank you so much for having me to speak on this important topic today. And thanks for convening this event today with so much helpful information, lots of great stuff in the last group. And I'm really honored to be a part of this on behalf of the Business Roundtable. So just for those who don't know, the Business Roundtable is an association of over 250 CEOs of America's largest companies. And the CEOs themselves are the members, and the CEOs very much drive our agenda. And I would pull back as we think about kind of what businesses can do and what a public-private partnership in this effort looks like. I would sort of pull back to look at the big picture and just say our CEOs members view this whole effort as a partnership and really are all in to do whatever they can to help every American get vaccinated, and to also make sure that this effort reaches Americans of all races, ethnicities, all backgrounds, every socioeconomic strata. So really there's a true partnership in the biggest sense that whatever resources our companies can bring to bear, they want to bring to bear, whether it's physical sites, logistics, money, resources, everything they can do. And they've been approaching it with that attitude from the very beginning of the pandemic, from firing up planes to get PPE from overseas into the US in the very beginning, and now kind of in the reverse, putting them on planes to get to other countries now. So it's very much a CEO-led effort to try to do all we can do to help with this vaccination effort, and again, to make sure it reaches all Americans. So they're all in, and they've very much instructed us to be all in, to make sure we're doing all we can to help with this effort. And so I'll just mention a couple of things we've done, BRT as an organization, on behalf of our members, and then just mention a couple of things from our individual members. So for BRT as an organization, we have really focused in on this, on vaccination. We've been thinking about it a long time, since even before the vaccines were available. Obviously, we have members who are directly involved in the development and distribution of the vaccines, who have been working just round the clock for well over a year and a half now. And so that's a huge part of, I think, what the contribution that large companies are making. But in addition to that, we launched a multi-pronged campaign that we call our Move the Needle campaign, which is really to support distribution and to encourage vaccine uptake. And the campaign includes a couple of elements I'll mention. One is a partnership with the Ad Council and COVID Collaborative for a really major undertaking in a public education ad campaign. And we think it's one of the largest in history, and we're very proud to be associated with this. But a huge component of this is to make sure there's research tested and targeted messaging to reach and resonate with Black and Hispanic communities, and to understand that that there is the systemic inequities that have led to vaccine distrust and distrust of the healthcare system. So we need to employ trusted voices, both national voices and then at the community level, community voices, to reach communities that may be hesitant to get the vaccine. And as we heard in the last panel, not everyone's reason is the same. So we've got to be making sure we're targeting voices at those different communities that may have different reasons for hesitancy. So the campaign, again, this is big picture stuff, but I think has been a really, hopefully, very effective effort. And it also was the campaign that was part of the past president's ad, which hopefully some of you saw, which was encouraging vaccine, really a show of great kind of bipartisan and political coming together to encourage vaccination. So that's one of the things we've been doing as part of this campaign. Another one is also, we're a founding partner of the Health Action Alliance, which is something we've done with Ad Council, CDC Foundation, Robert Wood Johnson Foundation, and others. And this group has worked to put together and disseminate a bunch of well-researched and message-tested resources to help businesses of all sizes communicate with their employees. So this really recognizes that our members are very large companies, and we have incredible resources and teams to help communicate with our employees about the importance of vaccination, to make sure that it's reaching them, reaching their families. But not all businesses have those resources, and not everyone works for a very large company. So in order to really reach Americans of all different socioeconomic levels, you've got to help the small and medium-sized businesses understand how to communicate about this too. So this effort has produced and is disseminating these resources, getting them out to small and medium-sized businesses. And we're using our social media channels and the reach that we have through our CEOs and our member companies' social media channels. I think that the stat is that through all of those channels, we can reach 1/3 of all Americans. So we're really using those channels to try to get those resources out to small and medium-sized businesses and encourage vaccination that way. And I should say, those resources are also multilingual. They're in different languages. So it's, again, recognizing that you need different resources for different communities. So that's a little bit, again, one other thing I would say that we've done as Business Roundtable is we've encouraged every company to provide paid time off for vaccination and recovery. I know there was a lot of talk about that before, and we've talked, your report talks about that, we've talked about it, but again, really something that everyone can do, every business can do for their employees is time off to get that vaccination and for the recovery time. Just a couple minutes about some of the individual company efforts. Again, I think all our companies view this as a true partnership. So reaching out at the local level and the national level to all levels of government to offer whatever resources they can. But we've seen a lot of companies offering paid time off, offering incentives for their employees. We've seen some creative efforts to get customers vaccinated. We have Albertsons, a great member, has run a promotion for up to $200 of groceries for customers who get vaccinated. Target has offered some incentive coupons for customers who get vaccinated. And we've also seen a lot of companies use their physical plant resources, their physical sites, to provide opportunities and places for people to get vaccinated. We've had Delta provide a mass vaccination site at their offices. I know we've heard about that. Union Pacific Railroad created a mass vaccination site at one of their switching yards. And then we've also had companies making contributions to the philanthropic efforts that we've heard about with the rides to get people to the vaccination site. So Delta working with their loyalty program to provide incentives for people to contribute to the Lyft effort to give free rides to vaccination. So it really runs the gamut, I think, across all the different ways that companies can participate. And I would say that there really is no resource that is too small or too large for a public health official or a national official to think about asking a company for in this fight, because again, as I said at the beginning, we are all in.
Some great examples and a lot of collaboration, true partnerships packed in there. Thanks, Liz. I want to come back to you with a few of those details of what's really worked. But right now, I'd like to turn to Lisa. Lisa, we heard earlier about how over 90% of Americans are within 5 miles of access to a vaccine, and how we want to build on that further. But Walmart's been a big part of getting vaccines out into communities, particularly those with high level or low levels of socioeconomic status, diverse communities, and the like. And I know you've been involved in a number of partnerships with community organizations in not only bringing the vaccines out more widely, but connecting to people in those communities. Could you talk a bit about what you've learned in the process and any other lessons that you'd like to highlight for this group?
Yeah, absolutely. Thank you so much for the opportunity. You mentioned that 90% of the population stat, actually 90% of the population lives within 10 miles of a Walmart. So we're very, very close to all of America.
Big part of that contributed.
That's right. That's something we're extremely proud of. But another stat that we're extremely proud of is that 80% of our stores are located in medically underserved areas as defined by HRSA. And so we knew from the start, prioritizing those medically underserved areas for vaccine was going to be critically important. So when vaccine was in short supply, getting the vaccine to the underserved communities was going to be extremely important. But then we know we had to go one step further, which is actually then taking that vaccine even further out into the communities. So we really started our effort on the south side of Chicago, working with Black and African American physicians and dentists in the area, as well as the aldermen who are in the communities, who are trusted resources in those neighborhoods, to do an education and vaccination campaign. We've since expanded that to hundreds of community organizations across the country, from low-income senior housing authorities in Mississippi to immigrant community centers in Nevada, and really everything in between. And some of the lessons that we've learned are those local leaders are so key to your effort. You can pop up a vaccination site somewhere, but that doesn't mean that people are going to show up. And I think it was mentioned earlier that the hesitancy, the questions, the barriers are just a little bit different in every community. And those local leaders know and understand the barriers. And they're also trusted resources for those questions to be asked and those answers to be heard. And so we've really worked to arm the local leaders with vaccine education and let them spread it. Then we'll come in and do those vaccinations. Faith leaders have been extremely important and trusted resources in communities, especially in low-income communities, communities of color. That has been so important. The other thing that we've seen is addressing all the barriers. So partnering with organizations, it might be transportation, it might be childcare, it might be time off. There's so many different things to consider. But some of the lessons learned, just briefly, have been making sure that the date of the clinics are announced in enough time ahead that people have time to plan. But then just as important in our recent effort has been nationwide walk-ins, so that people who can't plan or don't want to plan have equal access to those opportunities to walk into our stores and get vaccinated at any time. So I know we're going to dive into a lot more, but a lot of lessons learned. But the community partnership, that trusted education resource has been so important.
Great. Thanks very much, Lisa. I do want to build out on some of the examples and categories that you and Liz have described. First, I would like to go to Dan. So Dan, speaking of state and local partners, I know since we've been working with you pretty much throughout this pandemic with you getting out in front in Washington of bringing the private sector in as effective partners, I know you've thought through this a lot and have a whole structure set up at the VAX program for really leveraging and building on these public-private partnerships. Can you talk a little bit about some of the key things that you've done, key lessons that you've learned about how to work with the private sector most effectively?
Sure. I'm just going to hit some highlights, and I know the paper that you published talks about some of our work, but I'm going to first start with, even though we're primarily past this piece of the puzzle, which is just information about vaccine location and scheduling appointments, and now that we've really moved to where we have walk-ins, it's still important for people to easily know where it's convenient. And we stood up in 6 weeks. We ideated and launched a vaccine locator tool. We built it. Our whole approach has been equity by design. So we launched in 30 languages with 6 accessibility settings. And we recently, working with providers across the state, now have information about access at different sites, wheelchair accessibility, language accessibility. And so surfacing that information is critical for certain communities. So I just wanted to flag that. What we did, though, was we did that and then recognized there's the digital divide. And so actually working with Amazon, we really ramped up our call center using cloud capabilities. And that has allowed us, for instance, over 500,000 people have used the call center. Actually, 2.3 million Washingtonians have used our vaccine locator tool with a 70% click-through rate. So that, we are reaching people. But the thing I just wanted to flag about the call center is by using technology, it's freed up agents to actually make appointments for individual people who really are otherwise challenged doing so. So over 30,000 appointments have been made with agents. One thing as we're looking forward that we're going to start a pilot with is the issue as we move to approaches similar to Get Out the Vote campaign is whether, rather than be in a response mode with our call center, can we start using it in a canvassing way, working with community-based organizations where one thing we've found in terms of the community-based pop-ups is the need to remind people right before, hey, it is Sunday, remember to come. And so we haven't tried it yet. We're about to, but to see whether we can use that asset that we've now built in terms of call center to use it in this latter, this part of the campaign. There's been a lot of discussion about transportation. I am pleased to report that we did announce our transportation before the Biden administration did. The only thing I'm going to add there is we tried to take a holistic approach, and yes, we have Uber and Lyft. And one of the things we did there was we partnered Uber with, we have one clinic organization that reaches the Latinx and other underserved communities. And we got codes to them and to sister clinics. So that way, when they were working with their clients and patients, they could provide the rides. So it marries it more closely. So wanted to flag that. And also the other piece that we did is we worked with the mass transit across the state. I kind of did it in a domino way. But we, for instance, Spokane, which is east of the mountains, they just announced a partnership with us. So they'll have 1 month free door-to-door ridership. So there's Uber and Lyft, but then, you know, the footprint of Uber and Lyft is, you know, coextensive. So I just want to flag that. Let me just think very quickly if there's anything else I want to mention. Oh, the other thing I just want to mention that we've done kind of ties in with the notion of how do you package up resources, both for smaller employers as well as for community-based organizations. So we put together resource guides, tried to reverse engineer. If you were an executive director, if you were the HR director for an organization and you wanted to do a pop-up, how would you do it? And so because we've had great partnerships with the likes of Amazon, Microsoft, Starbucks, and others who've done pop-up clinics, I've gotten agreement from them to act as advisors. So for instance, if there's a small employer, they can call one of these folks who've been involved to very quickly figure out what you need to do. The same thing with community-based organizations. And last but not least is really making the connections between the trusted influentials. So we've worked closely with a group called Adios COVID, which is affiliated with the University of Washington. We have over 1 million Latinx in the state of Washington. And so they're providing the linkage between the Department of Health, my work with the private sector, and the CBOs, so that when CBOs want to do pop-ups, making sure they have all the pieces of the puzzle so that they can have a successful pop-up. So I'll stop.
Great. Thanks, Dan. Covered a lot. And for people who want to hear more, so there's one question and by the way, bringing those questions that Andrea answered about know more about the directory and some of the resources that Dan described. It's covered in our report. Dan, if you've got other links that you'd like to share with the group, please do in the chat box. But it's a really systematic approach to all the ways in which states, local governments, the public sector needs help, and a way of organizing that help systematically as it comes in from so many diverse parts of the private sector. So a great set of resources. We got a few minutes left. I really appreciate those overviews. And I want to give you a challenge as we're looking forward. So lots of good news that we've talked about today, and the steps that you all have described have gotten us a long way towards controlling COVID across the country. Still a ways to go, particularly for rural populations, for socially vulnerable populations, but important progress. The administration set a goal of 70% of people getting at least one shot by July 1st. And if you look at the numbers, it might not seem like it's that hard. We're vaccinating maybe 1.8 million or so people per day now. If we keep up that pace, we should easily get there. But I do think it's going to get harder because we're getting to smaller groups of the individuals who sort of like the get out the vote effort. Everybody who really wanted to vote kind of already done it. So there's smaller groups that haven't been reached yet by efforts that have been widely applied to connect them to vaccinations. And there's still a significant part, it's smaller than it was a couple of months ago, but a significant part of the population that still has real concern. So I want to challenge you all in these last few minutes to maybe give some examples of promising steps in both of those areas where, frankly, I think we're going to need to depend even more on engagement with the private sector and people who are so close to their employees and to customers all over the country. So maybe we could start with the remaining individuals who haven't yet been reached, but who are willing to get vaccinated. Not sure who wants to go first, but you all each talk about got some promising steps. Anything that you'd particularly like to highlight out of all of the creative opportunities out there, lotteries, time off, gift certificates, gift cards, et cetera? Other additional ones you'd like to highlight for this next challenging couple of months ahead to really get vaccination rates up?
So I'll just, oh, you go ahead, Liz.
Oh, just quickly, because you're much more boots on the ground than I am. But I would just say, what everyone has said is just to be ready to be nimble and shift to where the hesitancies lie, because it's not going to be the same group. And you've touched on this, but just making sure whatever was working yesterday to get people vaccinated is not the thing that's going to work tomorrow. And I would just say, whatever resources the folks on the ground need, to think of their business leaders and their communities to look to them for those resources. So that's just, again, a big picture point. But, we had one example with Anthem. I remember Anthem made a commitment with AHIP and some others to leverage their data to really identify vulnerable seniors in underserved populations who might not have access or ability to get vaccines, and then targeting messages to those groups. So again, leveraging data. Now that's, that can be tricky, but just thinking as these groups of unvaccinated people shift from one type of group to another type of group, finding ways that we can appropriately, of course, and carefully and always with privacy in mind, but leveraging data that we have access to make sure we're understanding who those groups are and targeting messages and facilitation tools, rides and things at the groups that are actually the ones who have yet to get vaccinated.
And this doesn't just on the privacy issue. I really like this concept of healthcare employer collaboration. This doesn't necessarily have to be done at the level of an individual employee, but just knowing where you, as you said, where you've got access in vulnerable communities matched up with where insurers have patients in those communities. Great opportunity for partnership there. Dan, you were going to add something?
Yeah, just a couple of different things. One is on the incentive front. First of all, I think, even though it's been discussed, I think the criticality of the employer-based incentives and employer site vaccination, because I think one of the areas that's critical is call it peer pressure or peer comfort. Anecdotally, I've heard a lot about that, and that may just be the tipping point. It's just so easy. You're there, you're in the workplace. So the more that we can encourage smaller employers and make it easy for them to have on-site is phenomenal. In terms of what I call the business to consumer incentives, I think those that are linked, and I know this gets tricky in some jurisdictions, linked to the benefits, directly to the benefits of being vaccinated. So that section of the stadium or a venue where if you're vaccinated, you don't need, you get to be closer or fill in the blank. I think it creates a nexus, and the data on people not having to wear masks. I know it's confusing across even within states, let alone across states where jurisdictions are on the masking. But I think that the more that you can link the incentives to the benefit of a post-pandemic world, the greater the success.
Thank you, Lisa.
Yeah, I would like to echo the peer influence, especially in the workplace. We have the advantage of being a large healthcare provider and also a very large employer. And as we did on-site vaccination for our own associates, we would see that when we did the first dose clinic, there would be a certain amount of uptake. And then we would come back for the second dose clinic, and there would be all these more first doses. And they saw their peers, their friends, their coworkers getting vaccinated, and it made an impact on them wanting to get vaccinated that next go round. So sometimes you have to repeat the events too to combat that hesitancy. We've also been using vaccine influencers within the company, associates at all level of management, diverse backgrounds in the communities talking about their vaccination story. So people see their coworkers, see people who look and feel like them getting vaccinated has been really important.
Yeah, great comments from all of you. And I too really do see the front lines of combating this pandemic increasingly shifting into the workplace as more people are trying to come back to the office, as employers are dealing with issues like what to do about masking for their employees, for their customers. As we see more people getting together, those peer effects involving both employees and customers, so important. You all have been on the front lines, but I think increasingly so as we enter this next phase of trying to get the United States beyond the pandemic, especially for our lower income, more vulnerable populations, racial and ethnic minorities that have been so much a part of the disparities in the pandemic to date. So I want to thank all of you for a really good discussion on this panel. I would also like to say that we are continuing to work with Walmart and the BRT and Dan and many other public and private sector collaborators around strengthening the activities on this this very important front. So more to come from Duke Margolis and our collaborators at the Commonwealth Fund and the COVID Collaborative on these issues. So please stay tuned and check back with us and get on our mailing list about all of this. I would like to close with some thanks all around. First of all, thanks to everyone who's joined us on this webinar today. I know many of you, I've seen the list, have been actively engaged in working on the issues that we've talked about today. Appreciate your time and effort today and the comments and questions, not only during this webinar, but to help guide our further work on addressing these important issues related to equity and access to vaccination in the pandemic. I also want to give a special thanks to our supporters in this effort, as I mentioned, the Commonwealth Fund for their deep commitment and support for moving beyond not just this pandemic and the health inequities in this pandemic, as David Blumenthal so eloquently stated at the top, but making sure this never happens again. And then second, and very importantly, to the COVID Collaborative, working with us on a wide range of topics in pandemic response, both domestically and globally, all the work and all the groups that they've brought together to enhance vaccination. And then a special thanks to the team that brought together the resources, that report that I just mentioned, and others that are coming for the content of today's event. Amy Tourson, who will be moving shortly to head up a National Association for State Health Policy and continuing to collaborate with Duke Margolis in that capacity, also working even more closely with states, and also Andrea Toomey, Katie Green, Katie Huber, and Kirk Williamson. Thanks to all of you for putting this together. And again, thanks to all of you who joined us today. Stay well, and again, appreciate all your support in moving through the pandemic.